Hello, listeners and audience. I would like to welcome our new guest, His Excellency Dr. Ahmed Al Saidi, to episode 3 of Global Health Dialogues with Princess Dina. Dr. Ahmed is former Minister of Health of Oman. He served as Oman's Minister of Health from 2010 to June 2022. During his tenure, he played a pivotal role in advancing the nation's healthcare system and was instrumental in leading Oman's response to COVID-19 pandemic. Dr. Ahmed has an extensive medical and academic background. Professionally, he is senior consultant rheumatologist, and he has held significant positions at the Royal Hospital in Oman. In 2008, he was appointed as Undersecretary for Health Affairs, a role he held until 2010 when he became the Minister of Health. Dr. Ahmed was instrumental in strengthening Oman's global health leadership during his tenure as Health Minister. In 2020, he was elected as the first chair of the Executive Board of the World Health Organization, and he has chaired the Supreme Council of the Arab Board for Medical Specialties since 2019. On a personal level, he is a friend, colleague, and mentor. Welcome to our Global Health Dialogues, Dr. Ahmed. My first question to you is the fact that it is impossible to start a conversation about Oman health system before addressing the important role of political will that oversaw the unprecedented health revolution that took place in Oman starting 1970, coinciding with His Majesty Sultan Qaboos becoming ruler of Oman. Can you please tell us a bit more about that?
Your Royal Highness, Princess Dina, it's a great pleasure to see you, and it is a privilege and honor as well to be in your podcast, and I echo your welcoming to the audience and listeners to this podcast. Healthcare in Oman, as we know it, started truly in 1970, even though the first missionary clinic was opened in 1893-94 by a gentleman called Dr. Thomas. I was born before 1970, as I think it's obvious, but in 1970, the healthcare in Oman was still dependent on missionary hospitals and very few primary healthcare centers, which are mainly in the capital city, Muscat. I like to use numbers to highlight the important and the great changes in healthcare system in Oman after His late Majesty Sultan Qaboos became our beloved Sultan. And I like to use numbers. Life expectancy in Oman in 1970 for men was 49 years only, i.e. I should not have been here if there were no changes. I'm over 49. And for women, as usual, you live longer than us ladies, 50 years old. Vaccination were never heard of in Oman at that time. Infectious diseases were killing most of the people in Oman. They didn't live enough to have non-communicable diseases, cancer, and the like. So the first two priorities late at Sham Sultan Qaboos put for the country, health and education. And his role of leadership, honestly, it's an example of how nations can be transformed from darkness to modernization with preservation of our heritage and culture. So I gave you the numbers of life expectancy, infant death rate, 1970, early 70s, basically where about 120 died in their first month, and more than 170 out of 1,000 die with less than 5 years old. Maternal mortality was also very high. We had, I think, not more than 15 doctors in 1970 and about 25, 30 nurses serving the whole country. And of course, for those who don't know Oman, the size of Oman is the same size as the whole of the United Kingdom, with difficult terrains as well, between the mountains, the wadis, the desert. So basically, healthcare was not existent. Within no time at all, and with the determination of His Majesty and His government, and the very, alhamdulillah, good friends that Oman had, doctors from different type of the world, within less than 30 years of him becoming the Sultan, life expectancy jumped from 49 to 76. Infant mortality dropped from 120 to, I think it was 10.5 at that time. I'm talking about after 30 years. Child mortality dropped from 170 to about 8.59. Maternal mortality also dropped. We at the moment have more than 12,000 doctors instead of 12 doctors, more than 25,000 allied healthcare professionals, and of course, over 70 hospitals in the country. And the status of healthcare in Oman is, I would say, comparable with many Western countries, with very little money spent on that. I think we are also lucky, the population, most of them still young, but still, the changes are remarkable. And in Human Development Index, Oman was rated one of the best during the first 30 years of His Majesty's period. And we are very proud of this achievement. I was the fourth health minister in Oman's history. And I'm grateful to the three who were before me, particularly the one who was immediately my boss and before me, Dr. Ali Musa, because he was instrumental in establishing a very good, excellent, I would say, primary health care, which we all know it should be the backbone of any proper healthcare system. It's accessible, affordable, and our target was to have a health center for each 10,000 of the population. Yet we have health centers in remote areas in Oman serving less than 400 or 500 people. So a lot has been done in the period before me, and I continued basically the same, but my background, as mentioned, is a rheumatologist, hospital-based, and when I was appointed as an undersecretary, then as a minister, my colleagues in the primary healthcare were worried that this guy came from hospital background, he is going to ignore primary healthcare. I said, oh, we're going to continue strengthening our primary healthcare, and if we have time later on, public health.
Yes.
But in addition, we'll definitely need to strengthen our secondary, tertiary, and care, because patients will have many years of excellent primary health care, but then if they go to the hospital and the care there doesn't match what they've been used to, we would have been failing them at that stage.
Yes. Definitely, I think it's the example of leadership in transforming healthcare. Oman is the best model for that. And that's why I wanted to highlight it, because truly it was the health revolution in Oman, as you said, going from the dark ages to actually winning awards by WHO as one of the best health system in only 30 years. It just shows you how important political leadership is. So when you came in 2010, when you became health minister, of course, a lot that was done, from your predecessors. The foundations were put in place, as you said, from primary healthcare. I think you have now maybe even by then over 200 primary healthcare centers. So that was fantastic. But as you said earlier, a lot of it, the other part needed consolidating. So I would like you to tell me, when you became health minister, what were the main areas that you saw as that were still challenging and that you needed to focus on and to start, in a way, taking on the mantle from your predecessors and building upon the health system, building upon what they did to actually meet the needs of your time.
How much time do we have, Your Royal Highness?
We have.
I consider myself, of course, I'm honored by late Shams and current Shams Sultan Haytham Trust to be in charge of healthcare in Oman for 12 years, 3 months, 16 days, and 2 hours, roughly. Not that I was But I consider myself unlucky because the time I was an undersecretary, then became a minister, we've been through quite a rough time. Everybody knows the financial crisis 2008, which affected the whole world, and we rely on oil and gas for more than 75% of our income. The prices were very low, so financially we were not very strong. Then, of course, H1N1, which everybody, I hope, have not forgotten but learned lessons from, hit also the world, and I was initially under secretary, and then I became a minister while it was there. And for this part of the Arab world, also there were some disturbances in 2011, which some people would like to term it the Arab Spring. I've got different names to it. It definitely was not a spring for many countries, and I think the evidence now are clear. Oman was affected, but luckily, again, we'll go back to the true leadership. And for a person who cared about his country and his people more than himself, late Hashem took action immediately, and the impact of 2011 crisis in Oman were not as bad as they could have been. So we've passed that, and then I had some time to think about healthcare. And I've mentioned in my previous reply that hospital care was not up to the standard. So I had a great and a wonderful team, honestly. Of course, without them, I would not have been accomplishing anything. For me, the leadership is the team, not the person. The person I was facilitating. After 2011, after all settled, we looked at how much been accomplished in the first 40 years of His Majesty's being the Sultan of Oman. And we had a very detailed analysis about the strengths, weaknesses of our healthcare system and social actually support as well, because health in isolation doesn't mean anything. And it took us about a year to complete all the data done by people from Oman and people working in Oman. Initially, no outside intervention. And after the analysis, we sent it to experts in the East, North, West, you name it. And then 2012, we had a conference in Oman. We put a roadmap for health. And of course, people were criticizing us. We called it Health Vision 2050. Why 2050? We completed 4 years. And there's another 40 years we want to plan. And during the conference, we invited all stakeholders. And I remember one of the comments from one of our parliamentaries, Majlis Shura. He said, this minister wants to put a vision for till 2050 because he wants to continue to be a minister until 2050. I don't think he had a clue how difficult it is to be a minister of health anyway. So we basically planned of what we need to do in the primary health care more, public health, hospital care, and what new services we need to introduce. So in summary, we plan to complete all the hospitals infrastructures in Oman. So we planned for 8 hospitals in the region of Oman where they were not good hospitals. We also continue to increase the infrastructure of primary health care, but in addition to the buildings, we definitely paid more attention to quality of care, whether it's in the primary health care or the hospitals. Within the first, probably before COVID-19 hit us, we introduced more than 180 new services in the healthcare system in Oman. I'll give you an example. Before 2010, liver transplant, which unfortunately affects younger people as well as older people for different reasons, was not existing. So if you have a liver failure, the end result is known, basically death. We introduced that actually immediately 2010 after I became a minister, and with collaboration with teams from different parts of the world, and the program's been very successful since then. Oman, like many countries in our region, or at least in the GCC, the hereditary blood diseases are very common. And the reason for that, of course, intermarriages, sickle cell disease, thalassemia, and the like. And the need for bone marrow transplant, of course, was there, but the need was not met because of many challenges. So same with cardiovascular. The number of centers of excellence we've opened. I would mention only a few of them. One is the Diabetic and Endocrine Center, and of course, diabetes. I think we might have time to talk about NCDs later. In the region is one of the, unfortunately, most burdensome condition. We open also the very, I would say, an excellent center for cardiovascular and cardiothoracic surgery, which is luckily rated as good as many centers in Europe and North America. We opened the genetic center, which is extremely important because I've mentioned already hereditary blood diseases, but we have many, many hereditary diseases. So in addition to the hospital we planned, and some of them were under construction before I left, and the rest of them also will start hopefully soon, the expansion of primary healthcare umbrella for the country. One thing also, which I'm very proud and happy that it's been accomplished, we concentrated on human resources. I would say probably when I was appointed, the percentage of Omani consultants in healthcare was not more than 30%. Today, they are more than 65%.
Amazing.
The studying medicine in Oman, we had only at that, we had two colleges. One is government, which was opened in 1986, and there's a private one, which was opened in the 90s. And we strengthened the Oman Medical Specialty Board for the board training, which is 4 to 6 years, depends on the specialties. But also, we sent many Omani candidates, not only doctors, nurses, allied healthcare professionals abroad. And these are the assets of healthcare in any country, and of course in Oman. And they came back, and they came well qualified and leaders in their field. And I'm extremely proud and grateful to them as well, proud by the reputation the healthcare in Oman has gained. When I came back to Oman, the trust in healthcare, not as a minister, as a doctor, was not that good, firstly. Secondly, I'm grateful to the expats from wherever countries they came from. But one of the reasons or challenges why the reputation of healthcare was not good, unfortunately, the healthcare providers, they do not speak the language of the patients. And I was astonished and surprised. How could you care for somebody when you don't understand what they are telling you? And not everybody in Oman speaks English. So strengthening the human resources, which led to Omanization, i.e. Omani individuals working in healthcare in certain discipline like nurses. Some of our hospital now, the Omani nurses, more than 90%. And for me, providing healthcare is not just getting the diagnosis and writing the prescription or operating and leading. No, it's education, communication, awareness. And this cannot be done without understanding the language, the culture, the sensitivity of the community you are serving. So I did not ignore the buildings and the expanding there, but I thought we'll build these hospitals, but if we don't have the proper, well-trained human resources, that's a waste of money. So alhamdulillah, we matched them, and Oman Medical Specialty Board now provide more than 27 programs of training. And for fellowship, we started some programs in Oman, but we still send abroad. And when I was there, sending abroad for 1 or 2 years is not just to get the knowledge and skill. I think the attitude is extremely important. And being exposed to different cultures and different background and different way of things are done is very, very important. I will not say this, but you could get a robot now to do so many things. But for me, the human touch, communication skills, leadership, the professionalisms are very important.
Well, I think, there's a lot to unpack here from what you said. First of all, I would like to focus on the importance of putting a plan. This roadmap that you put for Oman for 2050 that's exactly what other countries should do in low middle income countries or in all countries. Because, it all sounds overwhelming in the beginning, but once you put a plan and, it, like you said, it makes you look at all the other elements that have to be in tandem. Like you said, It's okay. It's easy to build hospitals, brick and mortar. That's easy to buy machinery. That is, if your country, of course, has money. But like you said, treatment is not gonna come about on its own without the human resources. So the fact when one sits down to actually think and put a plan, they are forced to think of infrastructure, of human resources, of prevention strategies, early detection strategies, how you're going to finance it, universal health system, and so on and so forth. And I think that's such an important point. And that is why I think the healthcare system in Oman is always building and moving forward and servicing the people. The other thing, I know that you were also the one who started electronic health records. Can you tell me about the digital health and the use of AI during your tenure? It'd be very interesting to know, because I was very, in a way, surprised that you were really started quite early with the electronic health records, and that's amazing. I know in Jordan we sort of finalized that in a way the past 2 years. So you were of the early countries who started that. Tell me about that, please.
I think the importance of electronic records were recognized by my predecessors as well, but because of resources, because of timing, it was not well established. When I joined the workforce in Oman after coming back, I was at the largest, and I will say, I don't care what people think, the best hospital, the Royal Hospital. And all our hospitals are good, by the way. And we started electronic medical records. And initially it was hybrid, some electronic, some paper. We worked very hard with the IT team from the Ministry of Health, with, of course, experts from abroad as well. And we established our own system, which is called a Shifa. And of course, for those who don't speak Arabic, a Shifa means cure or getting something better. It was not easy. Start with the resistance from healthcare providers, including initially myself, was quite high, because for us doctors, we are used to a patient, a piece of paper, and a pen. And we lost that. And some of my colleagues used to write prescription in the corridors, which was definitely wasting resources and maybe the inaccuracy. So we had a very intense discussion, debates between the IT personnel and the doctors and how to improve the system. I remember my own clinic as a rheumatologist. When we started, I was counting on average how many clicks I have to do on the computer per patient. And it was about 125 clicks per patient initially. So I said to my colleagues IT, by the end of this year, probably, if we continue like this, I will have definitely problems with my tendons, with my wrist. But they all worked very hard. And before 2010 even, I was in the Royal Hospital, then an undersecretary. More than 90% of our hospitals were paperless. And I would say 80% of our primary health care were also paperless. This saved a lot of money, reduced the errors of prescription writing, because everybody knows how doctors' handwriting.
I was about to say something about that. Happy to add handwriting of doctors.
We are not very proud of our handwriting, doctors, I can tell you that. And then, of course, we progressed to utilize AI. And the first study was done in Oman. It was done before elsewhere and implemented actually for mammogram reading for breast cancer. And my colleagues, the clinicians, they know, or the doctors, that the mammogram has to be read by 2 consultants independently, radiologists. I don't think many countries will have the luxury of having 2 consultants reading 1 mammogram independently. But they did a study, and actually the AI accuracy was 97%, so more than, and it was implemented. And I'm sure they are progressing, hopefully now further in implementation of AI in Oman. The issue was also the link between different hospitals and primary health care. That was established, and that saved a lot of money, because if a patient in one province of Oman, we call it Muhafa, the government, 500 kilometers from Muscat, and he or she referred to our tertiary care in Muscat, they don't need to repeat all the investigation. One click, and these 125 clicks, they are not there anymore. One click, all the data, all the information about that person will be in front of the new doctors. We also started, but we did not go very far, unfortunately, for many reasons, with telemedicine, because as I've mentioned, Oman is a huge area, and we cannot afford to have all the subspecialties in every hospital. So there's a lot actually done in IT and healthcare in Oman, and I hope it will continue and will get better.
The importance of digital health in promoting efficiency, cost savings, accessibility for patients, that's important. The use of AI in reading mammograms. But also, I would like to add that, because in my first interview with Jordan's Minister of Health, he was telling me that in a couple of months down the line, he will be announcing a virtual hospital whereby there will be a virtual clinic, so that exactly what you said, there is a shortage of capacity for people in rural areas to access expert consultants. This virtual clinic will allow access using telemedicine or whatever digital tool that they have, to be able to access that either for training with doctors in rural areas, giving second opinions and so on. So definitely the use of AI is going to help with shortages of expertise in all sectors, not only just mammography readings. I know some people utilize them for, supporting like centralized hubs for pathology readings and so on and so forth. So I hope Oman will take advantage perhaps of this sort of models of virtual clinics. The other thing is financing. I was reading about, how does Oman finance all of that? Because I saw that your universal health coverage is one of the best in the world. It's almost completely free for the citizens of Oman, for prevention, for early detection, for treatment, for rehabilitation. And if anybody has to pay something, it's so minimal. How is sustainable is that?
Well, thank you very much. I'll just comment a bit about virtual clinics and hospitals. I know how horrible COVID was, but there are many lessons which we might come to later. But one of them was actually the establishment of virtual clinics during COVID. Everybody knows the negative impact of COVID-19 on healthcare services worldwide. But we managed actually to have drive-through pharmacies for patients to collect their medication, virtual clinics, particularly for non-communicable diseases, and I would say more than 90% of our public continue to have the medication they used to get before COVID easily. I mean, probably 100% will get more easily. If we come to healthcare finance, which is extremely important, you can call me, I'm socialist by heart. For me, I think healthcare is one of the essential human rights.
Yes.
And I think those of us, people like you who care about people, care about healthcare, care about people with chronic diseases, if we know, or if people know that is 500 million, that's 500 million people, either pushed into further poverty or become poor because of out-of-pocket expenditure on healthcare. That's, for me, we should be ashamed as human race to allow that. For a country, and this is not politics, this is facts, for a country like the United States of America, where patients with cancer, only cancer, spend $14 billion from their own pockets on healthcare, on treating cancer only, and the main driver of poverty in America, and I'm using the best example, the richest country in the world, the strongest country in the world, but the main driver of poverty in the United States of America is the expenditure of healthcare for those who don't have the privilege to have the insurance. I have nothing against private healthcare. I have nothing against insurance, but we know, just for people who want to know about numbers, and these information are now probably 4 years old. The United States of America spend about 18.5% of their GDP on healthcare, i.e., over $11,500 per person. The European and rich countries spend about $3,000 to $4,000 per person per year. In Oman, before I left the government, we were spending about $800 per person per year. Our health outcomes in general are not much different than America. Life expectancy in Oman is better than many areas in the United States of America. Let me give you another extreme example. Cuba, they spend less than $80 per person per year, but their life expectancy is better than the United States of America. So it's not also how much you spend, it's how you spend it. Healthcare in Oman is still provided free of charge by the government. And for everybody who is an Omani or working in the government in Oman. And we introduced compulsory health insurance for those expats who are working in the private sector. How do we afford it? To start with, how do we manage, or how my predecessors also manage, especially the one who was before me, to get Oman a healthcare system as the most efficient one? I was in the UK when the Lancet published a report about the efficiency of healthcare system worldwide, done by WHO. And after that report, WHO learned the lesson not to compare countries because I think they were in trouble. And my boss, professor I was working with, he usually gets there before all of us. I think he's in the office, even the work started at 9, there at 7. And he came to the meeting room and he brought the Lancet, which he gets before us as well. And he put it in front of me. He said, "What are you doing here? Look at your country where they are and look where Britain is." I think Britain was number 27. But people misunderstood that. They thought we are number 1, the best healthcare service in Oman. No, it was the result we are getting for the dollars we are spending was the best worldwide. And our primary healthcare was rated number 8, the best 8. So the government does, and will hopefully will continue to pay for healthcare. Are we paying enough? No. And I said that when I was in the government. I'm saying it now. When I was appointed, we were spending 2.5% of our GDP on healthcare only, which is about $750. It's definitely not enough. And that's why, actually, in one panel discussion in the region, I was one of the panelists, and I said, mistakenly, people call us in this part of the world ministers of health, but we are actually ministers of diseases. And some people didn't like that, but that's the truth. We did not have the budget, the time, the resources to do the most important part of healthcare, which is getting people healthy, not treating them when they are sick. So the budget for healthcare in Oman, yes, increased, but then unfortunately, 2015 budget of healthcare in Oman was higher than 2019, 2020, 2021 when I was there. And this is not because the government doesn't want to spend more, because unfortunately, we've been through worldwide financial crisis. So yes, it's a social government healthcare system. And I wish the private healthcare in Oman will grow to compete with the government as well, so that the government can buy the service from them. But unfortunately, as yet, not many services provided in the private healthcare match the quality that's done in the government. The allocation of the budget for healthcare, alhamdulillah, is rising again, and it needs to be to match the increased number of population, the rate of the birth. I think we have about 80,000 newborns in Oman a year. That itself requires lots of money. If we talk about just renal dialysis, which unfortunately one of the, for me, most disabling conditions, chronic condition, it is very, very costly. And we have at least 300 patients extra yearly to cater for. All NCDs cancer, diabetes, respiratory diseases, and cancer, diabetes, cardiovascular, of course, number one. All of them in the rise because, alhamdulillah, we live longer now. And there's always a price for that. So are we spending enough? No. But we are much better than many other countries who don't have, unfortunately, the resources to spend even as much as Oman is spending. And it's heartbreaking when we know that a child born in Sierra Leone in 2015, his or her life expectancy is 50 years at this age, while a child born, let's say in Australia, at the same time, life expectancy is 83 years. So for those politicians who talk about equity, about human rights, about this and that, I think they need to reflect on where are they spending their money? What is the return of spending this money when they see their fellow human being suffering and dying from preventable condition, whether communicable or non-communicable diseases. So we are lucky in Oman, in the region in general, actually. I mean, I've been so lucky to visit your wonderful country in my capacity as the chairman of Oman Arab Board, and the quality, honestly, of your staff to start with, which again, that's the cornerstone of basically any healthcare system. It's very, very good. And you have challenges like everywhere else. But I think in the region, still in our region, we are doing better than others,
Yeah.
even though, and I will not elaborate on this, we are part of the Eastern Mediterranean region. And the challenges for healthcare providers here, for WHO, which were inflicted on our region, the wars, the displacement, you name it, the challenges are huge. And I wish that politicians, wherever they are, to spend more money on human capitals than on destruction.
Yes. Well, I totally agree with you on your last point. Absolutely. And I really commend the Omani government. You know, they focus on two things, health and education. I mean, this is the two pillars that's going to advance any society. And like you said, we even see other much richer countries who have so many issues of people, like you said, having to pay out of pocket or not given any health care or homeless people and so on. And yet Oman is taking that route to use its oil and gas revenues to actually invest in its own people. So really, really commend you on that. During my research about your journey, the COVID tenure seems to define your leadership, Dr. Ahmed. And it seems you were widely praised, and I quote here, which you're going to laugh a little bit when you hear it. You were widely praised for your calm and effective leadership during the COVID-19 crisis. How calm were you? We would love to know. I'm sure you were calm on the outside, forward facing, but we would love to know the trials and tribulations about how you managed this global crisis from start to finish, whether dealing with the actual purchase of the vaccine, disinformation, fear and mental health issues, and like you said earlier, how you manage also to continue services for other diseases, especially NCDs.
I can tell you, yes, on the surface, I was appearing calm and smiling, but inside there are lots of other feelings. We luckily started preparing for the pandemic in the, I would say, second week of January 2020. I had an excellent surveillance team. All of them are stars, honestly, and all of them were working, I would not say double the amount they should have done, quadruple. So we had the first meeting either 12 or 13 of January, and we looked at where are our weaknesses. And one of the issues that, of course, we are faced with in Oman, and I would say not you in Jordan, luckily, that we still import 90% of our healthcare the requirement, whether medication, equipment, and alike. So that's one issue we said we need to prepare well. The other one, and this is, we started a bit later, but still, the number of intensive care beds in the country. The third one, we said we decided we would definitely need more healthcare staff. And to be fair, His Majesty Sultan Haytham was very, very supportive. So the more cases worldwide appeared, the more we were worried and preparing. And the first two cases arrived in Oman were 22nd of February 2020. I still remember the day I had the news. And they were a couple who came from Iran. There's no shame of mentioning because it's not their fault that the pandemic or the virus was everywhere. And initially, the management of COVID-19 was the responsibility of the Ministry of Health. But of course, we realized that's not going to be enough. We talk now about one health and one government, definitely. Then His Majesty formed a National Supreme Committee chaired by His Excellency Said Hamoud, who was, I'll mention his name because everybody's the Minister of Interior. And of course, we have so many subcommittees or subgroups who are technical. And I can tell you the meeting in that committee was, yes, democratic, but sometimes those who are thinking about economy and finance more in this side, and myself and my colleagues on this side, and His Excellency, the chairman of the committee, was quite fair, honestly. We did not go into any of the extremes. We did not go to an extreme lockdown or extreme relaxation. We were monitoring and doing things according to many factors. Firstly, I've mentioned the economic and financial situation was terrible in 2020 in Oman because the oil prices dropped to, Oman was actually, the price they were getting for the oil is just to cover the production. So we were thinking about the economy. But before that, and the most important part I was repeating and saying, is human lives. So we were trying to balance between lockdown, relaxation, not allowing people to leave or come to the country. And it was check and balance. And also it was trial and error because the virus, like any other viruses, it changes its pattern every now and then, a mutation, new strains, and we have to adjust to that. We managed to get our need of ventilators, and I have to mention China was, I think, the only country, honestly, which allowed its companies to sell products, healthcare products, to countries in need. Our friends and allies in the West, their contribution and their input and their help was not zero, below zero. And they know that. And I said that frankly to them when I was in the government. So we managed to get enough ventilators. We've never had a patient who required ventilation who was deprived of that. There's a lot, but let me give you an example of intensive care beds. In some of the European rich countries, patients were dying in front of hospitals because there was no capacity, no ICU bed. So when the pandemic started in Oman, we had in the whole country, I think it's 145, but let me say 155 intensive care beds only. And we have the waves and we were increasing the capacity. And one of the most difficult phone calls I had was about 11 o'clock at night. I had a very, very hardworking, talented, and very dedicated person who was in charge of our crisis management department at the Ministry of Health. And he called me at 11. He said, "Doctor, we have only 2 ICU beds in the whole country." You can imagine, of course, when people's life are in your hands, you are in charge. Luckily, by the morning, these 2 beds were still vacant. That was the peak of that wave. And I said to you, we started with maximum private sector and the government sector. We started with 155 ICU beds. And that day we had 550 ICU beds in the country. So how did we do that? The hard work of the team, the generosity of His Majesty, and the public in Oman. We've opened an account. I don't know what other countries, but we've opened an account for those who wanted to do good things and donate. And we had enough money. We assembled or built a field hospital, 150 beds, within less than 2 months at the site of our old airport. And that, of course, relieved the pressure on other hospitals. And one of the things I think which I'm very happy with and proud that we initiated the first live press conference in Oman's history. And my hope was, when I suggested it, that my colleague, the Minister of Information, will be leading it, but it was left to me. They were supportive, all of them, the chairman, but it was not. People thought, this guy on TV every day must be having fun. It was initially a nightmare because I go to this big hall and the journalists, those who are in their cars, their offices, their homes, they fire any questions. My only preparation was I take a piece of paper with the latest number of that day. Transparency was definitely muqaddas, as they say in Arabic. It was a must. So we're telling people the number of new cases, the number of admission ICU, the number of admission in hospital, those who, Allah yarhamhum, passed away, died from COVID. We are giving them the information 100% as we know them. We also tell them what we know and what we don't know about this virus. And I always have my technical team next to me. And we are trying to educate them more and more about how to minimize the risk. And I mean, imagine a Minister of Health, not only in Oman, will appear and say, close the mosques, which we know how sensitive that's here. You're not allowed to travel. Close your shops. Do not visit your relatives during the Eid holidays. That was not easy. And if we did it without the compassion, without giving them the reasoning, we would have failed miserably. But I think the public were honestly on our side. And my indication for that, or my belief that they were, we reached 96% vaccination of the targeted population we wanted to vaccinate, which many countries didn't reach 70%. Many lessons from COVID we should learn. One of them, unfortunately, your friends, the friends indeed, friends in need. I think there's a saying there. Your friends did not stand by you then, you need to reconsider your friendship. Everybody was me, and me only. We need to have our own facilities to produce vaccines, which are very important, not only for COVID, for everything, our medical devices and equipment. I'll give you an example. When COVID started, gloves and gowns and protective equipment for our staff, probably 80% were imported. Today we have surplus and they export. The team actually of Omanis managed to produce also ventilators during the pandemic, and we had enough, but I hope they will continue the initiative. Vaccination a bit later than our neighboring countries, but we wanted to make sure. Personally, I always, when it was H1N1, I took the first vaccine in the country. For COVID-19, I made that commitment, and I had the first shot also of the vaccine live, which was a bit painful because the thanks to her, she was an amazing one. She's the same lady apparently who gave me the vaccine for H1N1. 10 years later, she gave me, but she was nervous because the cameras, the light. So I took the dose. For me, vaccines, safety is number one. Efficacy is number two, because we are giving it to healthy individuals to prevent diseases. But unfortunately also, multinational pharma industry, they made billions, but we managed to vaccinate people. The press conference, as I said, as an experience, was quite challenging, but was also extremely important. And I also made sure that I did it bilingually, English and Arabic, because we have a sizable number of people living in Oman who don't speak Arabic, our colleagues, the expatriate. So the last 30 minutes of every press conference for me was in English. And I told this story because there's one thing I also mentioned about press conference. One of my staff colleagues, who was a young doctor, he could have been the age of my daughter, because I don't have a son, but I have two daughters. He had COVID, and he ended up in ICU for over 6 weeks. He left ICU, but of course, with the weakness of his muscles, with difficulty in breathing, and I was following his case. Luckily, our healthcare staff who were affected by COVID were minimum. And I phoned him. I said, would you mind coming to the press conference? He said, but why? I said, I want people to hear it from you. Because when I talk about ICU, about difficulties patients face with the COVID, I can feel it, but still it's different than somebody else. So he came, and in the Arabic part of the conference, he did very well. He mentioned about the symptom he had, the difficulties. When he was in ICU, of course, he was not aware of anything. Then, of course, when I moved to the English part, I said to him, his name is Anas. I said, Anas, do you mind? He said, I'm sorry, but I cannot say anything in English. When I started talking about ICU and death, and there was one person between me and him. So it brought it close to home. And it was difficult, I can tell you. But I got through that. We got through that. And the press conference, I think, was honestly a success because of the transparency, because of the experts who used to come with me to the meeting place, the doctors who are specialized in infectious disease, the team. I mean, I go back and forth. The team I had, I could have never dreamt of a better team to manage the pandemic. The support I had from His Majesty and his government was overwhelming, but it was tiring and it was very stressful. One of the failures, I think, which we've had, and not only us, we did not have the capacity or the facilities for mental health well-being of our staff. We tried, but I'm sure many of them would have had some trauma because of what they saw. Some of them refused to go and see their parents for months before they realized that they can with protective measures. I have some of them working 36 hours non-stop, and we were complaining as public, wearing masks in public places. They were wearing masks, gowns for 8 hours non-stop each shift. And they were saying, we have to start thinking about what we can do in our region, not only in Oman. And I'm working on that now with some of my colleagues. The strengthening of public health, which I realized how important it is during COVID-19. And I wish we will continue to strengthen our public health. The importance of information and accurate information. You've mentioned the misinformation and the social media. We luckily filled the space with right information from right sources. There's still some, of course, from abroad and from here. And you know, the anti-vaccine groups worldwide, luckily they could not affect our public. They could not derail our sort of way of doing and managing COVID-19. I think one of the lessons worldwide should be learned. Instead of doing WHO, strengthen WHO, and make it responsible and accountable. But it's a shame to know that vaccines, luckily in the African region, the cases, whether they were underreported or accurate, but they were not as many as the rest. Otherwise, can you imagine if they had the same impact as other countries and their access to vaccine and healthcare facilities the way they are, it would have been a true massacre, honestly. I'm sorry,
Yes.
but that was very close to my heart, COVID, and what happened during COVID. I had good moments and very bad moments, but I think overall, with the support of everybody and with the wonderful team I've had, I think we did better than what even we expected.
And it is part of your legacy. When I was researching your tenure, it's definitely up there. Oman was touted as one of the best countries in the way it handled Corona, the efficiency, the speed. And I just would like to unpack or focus a bit more on what you said about transparency and those health conferences. We had the same in Jordan. And we would literally, all the family, whenever news at 10 would come, we will be waiting to see our health minister speak to us. And I think this should be a lesson moving forward for not just health ministries, but other ministries, to really actually, they should research the communication, the way it was done, the way there was such a trust built between the people and their ministries, which was never the case before, right? We
No.
never had this sort of communication whereby, like you said, you spoke about the issues, you spoke about what you're doing, you spoke about the difficulties, you spoke about, you sort of made the people feel they are riding along with you in that journey. And I'd like to also focus, just to add and confirm with you, vaccine colonialism, as they gave it a name. It was such a shame that when the COVID pandemic came, everybody went for themselves.
Yes.
And yes, it is a lesson moving forward for other countries not to sit down passively waiting for help, to start to prepare for their next pandemic and be ready and strengthen the health system in fighting future pandemics. And another point I would like to also add, especially from comparing the same thing happening in Jordan, is that so many things went well. Like you said, you managed to, there were also many quick decisions taken by the government, much quicker than they would have been done in normal circumstances. I know certainly in Jordan, smoking, when they said no more smoking in public spaces, no argile, no shisha, etc., it happened. Yet after the corona, it went back to business as usual, rather than taking the chance and riding on the fact that people can do it and that governments can implement laws when they want to. Unfortunately, it went back to the way it was before. And like you said, having the fact that you did virtual clinics to make sure that services continued. Did that continue? Does it continue now? Have they utilized that model that proved successful for Oman? These are the sort of things that governments should really research. What went right? What went wrong? What can we take forward from the things that we saw happen? So I think you should write a book about your experience about COVID. I really think it should be a therapy to have that huge global experience, on your shoulders. I really believe you should write a book. The other question is, in Oman, I know in your tenure, you really started to lay the infrastructure for combating non-communicable diseases. Where is Oman in that now? How is the impact? You obviously have, one of your burdens is cardiovascular diseases, responsible for 36% of all deaths in Oman. You've got cancers accounting for 11%. Of course, you mentioned diabetes and chronic respiratory diseases, diabetes contributing to 8% of deaths. Please tell me, what did Oman do? What programs did you establish during your tenure, and how is Oman doing?
But let me go back to NCDs. And I've mentioned already, we can prevent at least 44% of them with health promotion, and we can reverse at least another 40%. Oman, unfortunately, we are not very proud to be in the top 10 league of diabetes. We are either 8 or 9 worldwide, and our brothers in the GCC are ahead of us. NCDs, death in Oman, 72% of people dying in Oman is due to non-communicable diseases. And you've mentioned cardiovascular is the main killer. Are we doing enough? No. We started definitely, but we are not doing enough, unfortunately. Screening for cancer, I would still call it very, very early stages and primitive. Colorectal cancer now, cancer number one in Oman, killer for men. And unfortunately, the reason for that, by the time they are diagnosed, very advanced. And I hope that it's very easy to do it. I hope it will be implemented. And now there's no reason that there's no budget. We should. Diabetes, the first fellowship program in Oman, actually, after the board, was for diabetes training. And we intensify the education and the, of course, provision of the latest medication for diabetic patients across the country. So I think we are getting better there. And for me, again, the primary health care is not for patients to go there for treatment. Health promotion, education, and education must be an essential part of the training of our family physicians and the staff in the clinic. Cancer, I'm glad to say that we talk more about cancer now, because I challenge any person in any country who doesn't have either a relative or somebody they know who is either survivor of cancer or died of cancer. We have the Oman National Society for Cancer. They're doing a good job, but I think they need more help, and the government should do more, because I'm a strong believer still that this is the responsibility of everybody, but the driving force and the leadership should be with the government. Respiratory disease, luckily, are less in Oman. The first decision I took, 2010, when I became a minister, smoking is not allowed in public and closed areas whatsoever. The smoking rate in Oman, still not acceptable, but I think it's about 12% of our public smoke, and mainly men. You mentioned shisha and nargila, unfortunately, spreading, but we also put a halt to licensing from the Ministry of Trade and Commerce for places to provide shisha. Our food as well, there are regulation and to basically sugar, salt. I was surprised, and everybody was surprised, how much sugar in a loaf of bread. We studied, and I will not mention the name of brands of countries' bread here, but we found in one of them what is equivalent to 12 spoonful of sugar. So we put a limit to that as well. So we try to increase the tax on smoking. There were unfortunately not very much appetite from some of the countries in the region. They thought about how much tax they get. And I was telling them, let's say you get $1 million tax from selling tobacco. You'll spend $100 million treating patients with lung cancer, cardiovascular disease, and you name it. So I think we need definitely, as a group in the region, to strengthen our regulation for smoking particularly. Excess alcohol is definitely a risk factor as well, mainly for cancer, but other disease. Obesity. If you drive in any of our cities, unfortunately in the region, you see more what they call fast food places than anywhere in the world, and they deliver 24/7. Obesity in children in our region is a pandemic. So we are not getting much, but we are there, and there's slow progress and compacting NCDs. We are providing at least better health care, better treatment, sorry to say. But that's not where we should start. That by that time, it's too late. And I repeat this, that we can reverse, but particularly diabetes, when the patient come to us with stage 2, 3, or some of them 4, unfortunately. So I don't think the media doing enough. They are trying, but I don't think they are doing enough. And I think the media also, we need to utilize the media that the younger population use. This TV and radio and newspaper, they are good for people my age probably, but I think for the younger generation, definitely need to speak the language they understand. I'm worried because I am sure you saw the report where over the last 20 or 30 years, cancer in the younger population, less than 50 years old, increased by 79%. 79% in less than 30 years. And of course, most of the experts agree that what we eat, lack of exercise, smoking, and alcohol are the main reason for that. Luckily, smoking and alcohol consumption in Oman is less than many countries in the world, but I cannot say the same about not our diet, the imported diet. And I think we need definitely to pay attention to the younger generation, what they eat, how much physical activities they do. I've mentioned that the media they use for communication, but unfortunately overusing it and spending hours on their devices instead of exercising is going to be detrimental. But
Yes.
we can do still more, I think, for NCDs.
Also have the opportunity through your primary healthcare centers to rethink how they work, because if that is the first contact of people with any health center, a lot of health systems, they just deal with that one issue that the person comes with, rather than utilizing that point of contact to actually talk to the family or the patient or whoever it may be about tobacco use, about the early detection tests they need to do, about diabetes, and I think it's not just the media. Utilizing the media, of course, it's important, but also to utilize the primary healthcare systems that you so beautifully have. I mean, you have over 260 primary healthcare centers. This needs to be reorganized to make sure when that person comes, you use every opportunity to disseminate every single information that that person needs according to the age, gender. The doctor should be asking about their lifestyle, etc. By the way, do you have any screening for cervical cancer?
Only for those who go and ask for it. And we started many years ago. I was still at the Royal Hospital or under secretary. We started actually in the primary health care screening for diabetes, hypertension, cholesterol, and renal function. But screening for cancer, the only thing which I think now is, I would not say well established, but better than the other, is mammography for breast cancer. But one of the limiting factors was for that, the reporting of the mammogram, and if a lady was detected to have a lump or a suspicious lesion, the biopsy and the results. But for cervical cancer, which luckily I think the rate in Oman is not that high, but still it's in the rise like everything else. We definitely need to pay attention to that. And the public awareness is getting better, but still we are not there. Screening for the chronic condition I've mentioned already, I think it's in the rise. But for cancer, I think the initiative has to come from the person, which we should be actually letting them know that this facility is available and it should be available across the board. Even I've mentioned chronic, it's not so classified as one of the chronic diseases, but hereditary blood diseases are chronic. And one of the initiatives I came up with or I wanted is compulsory blood test or testing for these diseases pre-marriage, because that's where the problem is. If a young lady and a young man get married and they're carrier of sickle cell disease, they are guaranteed to have kids with sickle cell disease. I wanted to be compulsory, the test, without, of course, with keeping the confidentiality of the persons, and it was not approved at my time. But I'm glad to say now it is becoming compulsory. So we are getting there, but still a long way to go, particularly for cancer. I think we are better in diabetes and cardiovascular disease because everybody talks about them. I don't know why still in certain societies, talking about cancer like a stigma. It's just like mental health. For God's sake, mental health is as important and affecting the whole family. I mean, if I had a knee replacement, I might be in pain and limping for a while. But when you have Alzheimer's disease or similar, that's the whole family life is disturbed. And still, we don't want to talk about it. We don't want to know about it. Again, it's in addition to the misery and suffering of the family and the person himself, the cost. I think Alzheimer's in the West now, in America, is one of the most expensive diseases. So there's a lot we could talk about, but I know your time is limited and you gave me more.
We could go on and on. There's so many achievements. The fact that you've been 12 years and 5.5 months as health minister, You're the only health minister that I actually know who stayed that long. So you have a lot of history, a lot of achievements, a lot of learning from you. I think one needs many more sessions with you to learn about all the trials and tribulations that a health minister goes through. I mean, it's such a difficult job because you never sleep. It's a 24-hour job. You always have to be ready for what can happen. Last but not least, what is next for you? Because I don't think somebody like you can actually sit down and just do gardening, although it's, gardening is a wonderful hobby and I'm sure it's very relaxing, but I'm sure you still have a lot to contribute. What are you thinking?
Well, after I left the government, I thought I'll take 6 months off doing nothing. And after 2 months, I was bored, and I have a friend, and she said to my wife, I don't think it's wise for Ahmed to stay at home and do nothing. I was, of course, socializing, seeing my family more, repaying the years of my social disconnect. But that is a limit. So my aim actually is to establish, to strengthen healthcare, the private healthcare in Oman, so that can match the government, because I mentioned our colleagues, the expatriates, they go mainly to be treated in private sector. So I'm working on that aspect. I'm also repaying the community. I am in the board of trustee of 2 universities. And that can take a lot of my time as well, because there are so many meetings, and I'm passionate about healthcare. So I'm trying to inject that in these universities. But in healthcare itself, I've actually brought companies for production of vaccine and expensive medication, biosimilars. And I think we're going to see it a reality. Our brothers in Morocco already started producing vaccines in Morocco. There is another, hopefully, place going to be in Saudi Arabia. The reason Saudi Arabia from the GC is the largest population-wise, and they are very supportive. Oman also, we are expanding our production of health needs. So retiring is not in my dictionary as yet. I'm trying to introduce a 3rd medical school in Oman with one of the universities. And there's lots in the pipeline. And the balance, I was going to say, between social, family life and work life was lost.
So important, yeah.
For so many years. And one of the issues now, whenever I'm given a chance to talk to medical conferences in Oman or beyond, I tell them, please do not do what I did. I said, I have 2 daughters. They grew up, especially the elder one, Aisha, and I didn't know her because I was utilizing every minute God gave me to basically healthcare. And as you said, especially as a minister, whatever you do, it's not going to be good enough. Do your best. And in Arabic, ارضي نفس ضميرك والله. And also don't neglect yourself, which we all did, physical activities, and your family and friends. So I'm reconnecting, and alhamdulillah, I'm balancing much better now. But I need to still repay Oman for what I was given, because when I was born, there were no schools in Oman apart from 2. Finished my high school. The government took care of me. They sent me to study medicine, initially in the United States, then in Britain. And the country gave me a lot. What I did was my job, my duty, when I was paid for it. Now what I'm doing, I feel it's my responsibility. My payback time is now.
Amazing. I for one, I'm so glad that you're not retiring, because there is so much for you to contribute. I believe you've already done a lot for Oman. Yes, being a health minister was your job, but you gave so much more than that. And I just want to thank you for this very engaging interview. I hope our listeners feel the same way. I am so honored to know you, Dr. Ahmed. So I hope you have you succeed in all your endeavors. Please send my best regards to Helen, your dear wife, and the family, and looking forward to see you again. Thank you very much. Thank you.